everyone, and welcome to CCA's Medical Minute podcast, sponsored by Kroger Health. I'm Sherry Hughes, and today joining me is oncology nurse practitioner Jill Hunt. How you doing, Jill?
Good. How are you?
I am doing great, and we have a wonderful guest here to talk about vaccines, things that are going on right now. Dr. Olivia Kinney. Dr. Olivia Kinney is from Kroger Health, and you're a pharmacist, so you know medications. And Jill and I were talking about all the various meds that are coming out now, and particularly, Jill, the big vaccines.
Absolutely.
For sure. It's a really exciting time in the vaccine world over the last couple of years.
So we want to unpack, first and foremost, all that's going on around the COVID vaccine. I mean, we just had a new FDA-approved vaccine to come out. So, Dr. Kinney, when are we going to see people getting it? Will they get in lines again, or rolling out this vaccine? Because more and more people are, coming down with more episodes of COVID now.
Yeah, and I think the media is really, emphasizing the increase in numbers and incidents, and and then with that comes fear, and so then patients and people want to know what can they do to be proactive.
Yes, all great questions. There's a lot to unpack in there. You're right that last week the CDC approved the new COVID vaccine. We're actually calling it the updated COVID vaccine because it's not really new anymore. But it's for everyone who's 6 months and older. And that is necessary because the virus has mutated. It does that to survive. And so we don't have protection right now against the circulating strains in the community. So receiving the updated vaccine is going to give us the best chance at protection this fall, in addition to still washing our hands, wearing a mask if needed, and not going out and infecting others if you're not feeling well yourself.
Yeah, there's so many things going on. You don't know if you have COVID or if you have the flu, because I looked at my chart the other day and it said you are in line for the flu vaccination. You have to get vaccinated again. So there's that, and then there's the RSV. There is a lot going on. What do people need to know most, Dr. Kinney, about all of what they're hearing in the vaccination world?
Great question. I think that the most important thing is that vaccines are the original way that we prevent illness before it begins. And most of them are free, whether through insurance coverage or through other government assistance programs. And, we love free things. You can come on in to your grocery store. We're convenient, and you can get a free sample to try, and you can go get a free vaccine and protect your loved ones and those around you.
Right.
So we understand, before Jill gets some questions in, give us your role at Kroger Health, because you mentioned going into Kroger, getting a vaccine. I know that you're a pharmacist by degree, doctor.
Yes.
And so what is your overall role at Kroger Health?
Sure. I'm a very proud pharmacist. I came from West Virginia University, and then I worked in our Kroger pharmacies for a while as a staff pharmacist and then as a coordinator. So I work at our general office now in clinical program development, which means that if you come in as a customer, you're going to get a vaccine. I am working on the backside to update the scheduler, to educate our teams on what the vaccines are, to make sure that we're ordering enough so it's there for you. It's everything on the backside to build the program.
So what do our viewers need to know about the updated vaccine? Who should be getting it? Who should really be first in line? And
I'll go.
right? And then,
I'll be right behind you.
and then obviously, more importantly, are there any contraindications? Are there any people who shouldn't consider it?
It's very few people who should not get the updated COVID vaccine. Certainly those most at risk are the elderly, the infants, the people who have weakened immune systems. So I think maybe some of our audience who does have a weakened immune system in particular should get the vaccine. But it is for everyone 6 months and older, and it is one of the most well-studied vaccines. Very safe, very effective, and worth it.
Yeah, definitely. Let's talk about our audience. I am a breast cancer survivor, and a lot of our audience may have had a family member, not themselves, diagnosed with a cancer. What does that mean for folks in this category? I know some may still have weakened immune systems, but someone like myself, I'm a few years out now. I'm raising my hand to go first, but is it that I need to get that right away? I feel pretty strong, and like I said, a few years out and cancer-free at the time. So hopefully stay that way.
Congratulations.
Do I need to rush in there and get that vaccine?
I think it's worth it for everyone, regardless of your immune system status, to prioritize going to get vaccinated. It takes about 2 weeks for your immunity to build up. And so the best time to get it is before everyone around you starts getting sick. So that way you have that protection. But most of us have immunity already, whether from previous vaccination or previous infection. But we know that it wanes over time, which is why we need to keep consistently getting the vaccine to make sure we're protected.
And can you say that one more time? Because I really do feel like, how many times have I heard, well, I've had the vaccine, I've had all the boosters, I've had the virus, so I'm more protected than anybody else out there because I've had it all.
Right.
Can you just kind of debunk a little bit of that and explain why it is important to continue to re-up the vaccination?
Very happy to do that. The virus, its only goal is to survive. It's going to keep mutating to find new ways to make us sick. And so the previous vaccines, the previous infections we've had, they were all different lineages, different viruses. And so the vaccine that we're about to get is the first time that our bodies are going to have protection against this new virus strain that's in the community.
Right. And that is not very different at all to the yearly flu vaccine that we get.
Hey, so let's talk about the flu. Well, like we said, that's another vaccination that folks need to be getting right now. Is there a priority over one over the other, or do you get them both at the same time now?
You certainly could get them both at the same time. That is allowable, and it's convenient. If you have the luxury of going into your grocery store to get groceries every week and you want to separate it, that is perfectly fine too. The most important thing to me is that you do get both of those vaccines, because
If
both
you
of them
you get one, do you have to have a certain amount of time in between one and then the other?
You do not.
Okay.
The only time you have to split up between vaccines is if you're getting a live vaccine, like chicken pox or something like that, but neither of those are live, so you can get them together.
What about those people that say, I just gotten the vaccine and it made me sick, and they feel like they're sick from the flu vaccine, and now they've taken both and they're like, the vaccines made me sick. Is that possible?
It's not. They're dead vaccines, for lack of a better word, and so they're not going to make you sick, but they will make you not feel so great for a day or so, because that is showing your body that it's learning how to protect against the virus. It's working. So
and we've talked about this in regards to some of our cancer therapies, that you get an immune response, or you fire up the immune system, and you can get achy, and you can kind of feel a little worn down, like you're fighting off something. But that's just part of the immune response to the vaccine. The other piece too is that a lot of people have said, well, I got the vaccine and then I got the virus. And what the big thing that people have to remember is that it takes 2 weeks to develop full immunity. So if you're exposed to the virus within those 2 weeks, you still have the ability to catch the virus before you're fully covered.
Yeah.
which is why you should get it now.
You should get it
now.
before it's circulating.
Let's talk about getting it now, Dr. Kinney.
Yes.
If I'm in Kroger and I'm shopping and I say, you know what, there's not a line over there. I've done this before. I don't see anyone over there. What's the process? What's the path forward? Do you call them, make an appointment, or do you just stop in?
We pride ourselves on being convenient, accessible in your communities. So come on up, walk in. If you see that line, or no line, you can also make an appointment online if you prefer that, especially as a result of the pandemic. Our customers expect to have appointment-based systems now, and so that is accessible to you too.
And a lot of the Krogers have little clinics in them, and you can do both sites for the vaccines, correct?
Correct. Yep. We love our nurse practitioners, physician assistants. Collaborative care is the way forward, and so we try to partner with them as much as we can.
That's great, partnering, because we need a lot of that, partners to just ward off all of these different bacterias and viruses that are out there. And right now that we're going into the fall season, I've heard that kind of exacerbates because we're going into fall and then and then winter. So what's that role with the vaccines and the way the air is, or the way the weather is? Is there a direct correlation?
It is respiratory disease season, for lack of a better word. And so this is just the time of year as that virus is coming around. And so we do have more tools in our toolbox than ever before. Flu vaccines, RSV vaccines, COVID vaccines, masks. We're comfortable with those now, even though we don't love them. And so it's just that time of year, and get after it early.
Go ahead.
How do we know if it's a cold or if it's the flu or if it's COVID? Now every time somebody clears their throat or sneezes or coughs, they say, I don't have COVID.
Right.
But COVID now is just one of those things I think we're going to be living with for some time to come. But how do you know, doctor?
Well, if there's symptom charts that we can review, but the problem is they cross over. So there are a lot of the same symptoms. So if you were, and you're a nurse practitioner, so you could probably speak to this, that when you're diagnosing someone, a lot of times you say, now, which vaccines did you have? And you start to use your process of elimination in addition to tests available to diagnose if you do need further treatment or if you just have to write it out.
And I think a lot of it too is if you are not feeling well, before you go out and potentially infect the community, just test. We have easy access to the tests. A lot of the pharmacies even still have drive-through service where you can pull up to the drive-through, swab your nose, hand it over, and then get your results via email. So it is very much being mindful about what symptoms you're having. If they're outside your normal, seasonal allergy type symptoms. I mean, we all can have the hay fever, the sneezy, coughing, snotty. But if it's different than what you're used to, just be mindful. And so that, kind of being mindful so that we don't continue to spread.
Yeah. And like you said, there's still, like I flew last week and I saw several people on the plane with their masks on. We don't know if they're trying to protect us or they're trying to be protected from us or what have you, but those are things that you could do if you are feeling ill to, help yourself as well as the population. Let's dive a little, Dr. Kinney, into that RSV again. That's a big topic. You're hearing it on television, on the radio, and people are thinking it's something very new, but it really isn't. Because it's more, as you said, respiratory generated.
You got it. And actually, this is a great example of the innovation in vaccines. The manufacturers have been working on this for many, many years, and they finally cracked the code with what they need to do to build a vaccine that's going to be safe and effective. We often think of RSV only in children, but it really does impact the elderly in particular. It just manifests as a normal cold, so you don't know if you actually had RSV. And so this is the first year now that we have RSV vaccines for everyone 60 years and older. And then for pregnant persons, we can give them the vaccine between 32 and 36 weeks gestation, which is a really great option to give your unborn child some immunity, as well as a monoclonal antibody if you are already born for your infants.
Right.
Yeah.
So do you just go into your pharmacist or to get these vaccinations and you rattle off, I need a flu, I need the COVID, will they bundle them?
Absolutely. Bundling like insurance. I love it. Yes, we will. And that's really the benefit of getting to know your pharmacist or your nurse practitioner, your local provider. We're in your community. We live there. We want to talk you through what's best for you today. And if you're not willing to get them all at one time, come on back. We'll schedule you appointments in the future.
Yeah.
A lot of people have fear about this coming season because of the resurgence of COVID and because of, things like the RSV. Are you hearing of any other vaccines that are out there on the horizon that we might be hearing about here soon?
Yes, the CDC updates twice a year with the pipeline of what's coming down, what they're preparing to authorize. So it's a really exciting time. I think the future holds combination vaccines. We've talked a lot today about how if you don't want to get them all at one time, but what if we could overcome that by putting them all together in the manufacturing
really
side?
bundle them.
Exactly, true bundling. But that science, it sounds so easy, but it's really difficult. So they've been working on that as well as a universal vaccine because we talk about these specific variants. But what if we could protect from all the different iterations of it, right? So there's a lot coming down the pipeline, but not for this 2023 year.
I have to ask for breast cancer. I've been hearing there's a new vaccine on the horizon. Have you heard much about that and cancer vaccines or anything?
I think cancer vaccines are so exciting. And you recently did an episode on precision medicine.
Yes.
So I already heard about
Okay.
that, which is, that's the future, right? The future of healthcare is personalized. It is not generalized. And so having the opportunity to customize your treatment, either to prevent illness or to treat it, is the future.
Yeah.
Very good. Well, Dr. Kinney, do you have anything else, Jill?
No, I think we could probably talk all day on this.
We could, and we will talk some more about it because we'll have more to update folks on as we go through time. But thank you so much for coming and being on our Medical Minute podcast with us. And thank you all for joining us. Please make sure you share it and also tell your friends about our podcast because it's just chock full of information, and also subscribe as well. We will indeed see you the very next time on Medical Minute here at CCA.